Welcome. My name is Ellese Nickles. I am a doctor of physical therapy specialized in pelvic floor dysfunction, specifically treating pregnancy and postpartum women. I'm also a yoga instructor, and this sequence today is going to focus on relaxing tension in the pelvic floor, hips, and low back. This can be really important for dysfunctions like pelvic pain, pain with intimacy, urinary urgency, going to the bathroom all the time, and lots of other things. But additionally, it's just really good at down-regulating your nervous system. And we know that motherhood is not for the faint of heart. It is full of stressors. It is full of worry. It is full of overwhelm. And so this sequence can help bring us back into a state of calm. I think that this would be really a great routine to do nightly before bedtime, but really just any time that you're feeling overwhelmed or notice that you're holding a lot of tension in your body. So let's get started. Lying on your back, you can come into a position called Supta Baddha Konasana, and that is with the soles of the feet together and the knees open. Some people might like to add a couple of pillows underneath the knees just as a little bit of extra support, or if that's just not feeling comfortable with your body, feet wide and knees together. In this starting position, I really want you to feel like you're able to relax fully, not feel any strain. So find that position that feels best to you. And then let your body relax, fully coming into this moment, letting go of whatever else was happening earlier in your day or what else you might have on your to-do list later. Just letting the next 10-15 minutes be all about connecting with your body and hitting a reset button. We'll start with some breath work, a breathing pattern called square or box breathing. And what it looks like is through your nose, you'll inhale for a count of 4, letting your belly rise. You'll hold the breath there, so feeling the lungs inflated for a count of 4, and then exhaling for a count of 4, again through your nose, or if it's more comfortable, through your mouth. Then we hold at the bottom of the breath, feeling that emptiness, that emptying, and then again, inhale. So we inhale 4, hold, exhale 4, hold. I'll talk you through it. So all together, go ahead and exhale, empty out the lungs, empty out the breath. And then inhale. 4, 3, 2, 1. Hold the breath. Let the chest stay high, let the belly stay inflated. And then exhale for 4, 3, 2, 1. Hold the breath out. 4, 3, 2, 1. Inhale through the nose. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. Hold with the breath out. Again, inhale. 2, 3, 4. Hold. Exhale. And then hold. One last time. Inhale. Hold the breath. Feel the lungs inflated. Feel that air and energy circulating. Exhale slowly through the nose or the lips. And then hold. Good. And then just relax your breathing. Let's take a few breaths just on your own. Inhaling, feeling as though you're filling up with new energy. And exhaling, feel as though you are relaxing and releasing. That could be physically releasing your body, any tension, any holding into the floor. Releasing, letting go of any thoughts that are not serving you right now. Good. Taking some time at the beginning of this routine to reconnect with yourself. Come up to an all fours position, so hands and knees.
And we'll begin moving through some cat-cows. This is nice for getting
mobility in the spine and the pelvis. Inhale to arch your back and look up. Exhale, round the spine, looking towards your belly button, release the weight of the head. Inhale, drop the heart, reach the sternum forward, gaze out and up. Exhale, round the spine. Imagine you're pushing the floor away from you. Inhale, release the chest down and forward, gaze out and up. Exhale, round the spine, spread the shoulder blades apart, pull the belly button up towards the ceiling. One more time, inhale. As you breathe in and look forward, out and up, feel the shoulder blades draw away from the ears. Nice stretch in the front of the throat. And then exhale and round the spine. Tailbone tucks under, belly button pulls up, head releases. Good. Find a neutral spine, and then we'll rotate. So bringing the left fingertips up towards the ceiling, look towards the left hand. Ooh, find that twist. Exhale, thread the left hand behind the right wrist. This is called thread the needle. Coming all the way down until your shoulder touches the floor. I've got a little bit of weight in my right hand so that I have no strain or extra pressure on my neck. My head is resting on the floor, nice and relaxed. And then here, take a couple of deep breaths and see if you can feel the breath or imagine the breath moving into your low ribs, kind of around bra line. Nice. And then on your next inhalation, push into the floor with your right hand, reach the left fingertips up high, unwind that twist. Exhale, left hand down. We'll switch sides. Right fingertips lift up towards the ceiling. Inhale, and then exhale, thread the needle. Right hand behind the left wrist, shoulder to the floor. In this position, kind of try to square the hips. So just notice if the hips have shifted off to the left and draw them back so the hips are over the knees. Feel that rotation through the entire length of the spine. And then see if you can find a full breath here. On your next inhalation, push into your left hand, unwind and reach the right fingertips up. Exhale, hands down. Now, keeping your hips high, walk your hands out in front of you for extended puppy dog pose. You might choose to place your forehead on the ground, or if that is uncomfortable, either to your shoulders or your neck, you can kind of make a pillow with your forearms and rest your forehead there. The goal is to keep the hips high and let the forehead rest on something. And then in this position, just really feel that heart opening, that heart melting towards the floor. Nice and heavy and grounded. Find some awareness of the forehead making contact with something, either the floor, pillow, forearms, whatever it is. See if you can let that awareness create some relaxation across the entire facial muscles. And then bring your attention to your pelvis, the space between your sitting bones. And on an inhale, see if you can feel or imagine those sitting bones spreading apart. So inhaling deeply, feel an opening, relaxing in the pelvic floor muscles. And then exhale and just resting again, feeling that heart melting to the floor. One more time, deep breath in. And exhale. All right, we'll come back to lying on your back. So finding a comfortable position lying on your back with both knees bent. Let's start with the left knee coming in towards your chest and just make some little gentle circles, feeling the femur moving in the hip socket. Noticing any places where you feel some pinchiness or some tension, and that's okay, right? We're not judging or feeling like you need to fix everything, but just noticing in your body. And stay with that knee in towards your chest. You can stay here with the knee to the chest, or you can extend the left knee straight for bringing in hamstrings into the equation a bit more, holding on to either the back of the calf, the ankle, or the foot. Option to straighten the right knee. Now, just kind of really important here, you're not trying to find the most intense stretch. You're trying to find what feels good and safe in your body and gives enough sensation really for you to focus on that area. So if it feels like your leg's shaking or you're gritting your teeth, come back to that bent knee position. As we're trying to sort of stimulate, facilitate parasympathetic nervous system functioning, we need our body to feel safe. We need there to be less efforting, more just awareness. And definitely need to be able to breathe through all of these poses. Bend the right knee. We're going to come to a figure 4 position. So that left ankle crosses over the right knee. You can flex the left foot and then just kind of noticing what that feels like in your hips. An option here is to take this position and turn it on its side. So rotating until the left foot comes down towards the floor. I like to use my right hand to apply gentle overpressure to my left knee and then turn and look towards the left hand. It feels like really nice, very gentle stretching and opening, creating a little bit of distraction in the left hip. And if this feels uncomfortable, you can always come back to lying on your back in that figure 4 position. Return to supine figure 4. Take your left hand in that triangle space between your legs. The right hand wraps around the outside of the right knee, pulling that knee in towards your chest. And kind of just really little gentle movements, rocking side to side, like you're kind of rocking a baby and just feeling what that does inside your left hip. Noticing a stretch on the outer left hip, the piriformis. Again, checking in and making sure that the muscles of the face are relaxed, the jaw. And then you can find a soft breath. And then we'll switch sides. Go ahead and bring the right knee in towards your chest, making some little circles like you're kind of stirring a pot of soup. And then choosing what feels best on this side, recognizing that right and left might be asymmetrical. One side might be more tense than the other, and you don't have to do the exact same things on this side that you did on the other. You have option just to stay knee to chest, feeling lengthening in the right glute and low back. You also have the option to extend that knee, bringing more stretch into the hamstring. Whatever pose that you chose, can you bring your attention, your awareness to your back body? So the muscles of your back that are touching the floor, and see if as you inhale, feel those muscles pressing into the floor a little more. And as you exhale, feel or imagine those muscles softening. So again, inhale, breathing into the back body. Exhale, see if you can feel those muscles softening into the floor. And this might be where you decide more intensity really gets in the way of that, and you might bend the knee. Transitioning to figure 4 options, variations. Cross the right ankle over the left knee. Take the arms out to the side and rotate the right foot towards the floor. Again, I like to kind of fix myself in this position, applying some gentle overpressure with my left hand, and then turning and looking towards the right. Let your gaze be soft or eyes closed, keeping really kind of that internal awareness. And now starting to make your way towards a piriformis figure 4 stretch, bringing the left knee towards your chest, reaching through the space between your legs. Right hand through that triangle, left hand to the outside of the left leg. Gently rock side to side like you're giving a little bit of soft tissue massage, mobilization to the muscles of your back. Make sure that your head is resting on the floor. And if you feel like it's really kind of a strain to do that, grab a pillow, hit pause, grab a pillow. You want your body to feel like it can relax into the floor as much as possible. It does a lot for your nervous system to stay close to the floor, grounded. Last pose is happy baby. You can bring soles of the feet towards the ceiling and the knees towards your armpits. Some of you will feel great holding on to the soles of the feet. Others, it's a little too intense, and kind of just holding the backs of the knees feels better. Pick the variation where you feel you can keep the length of the spine connected to the floor. So I'm showing kind of not with the tailbone curled up, not with the head straining, but just really relaxing, nice and heavy here. Good. And then we'll finish with hips elevated. So grab a block, a couple pillows, some folded up blankets, and place underneath your pelvis. So typically when I instruct this, I see people put it a little bit too high underneath the lower back. I want you to make sure that that support is really underneath the sacrum. And then let the knees come in and just kind of rest together, the arms resting on your belly. And here, close your eyes and just let yourself fall into stillness. If thoughts come up and you start to kind of, in your mind, move away from your mat or the floor, away from your body, just gently nudge your attention back. Following the inhale and the exhale with your attention. Feel the soles of the feet relax into the floor. Relax the inner thighs. If you can feel awareness of the front of the hips relaxing. Awareness to the belly, letting go of any holding or tension. Bring the attention to the back of the rib cage and feel the back of the heart melting into the floor. The backs of the shoulders and neck melting into the floor. Let the attention come to the muscles of the face as you relax your eyebrows, as you relax your eyes, your jaw, and your lips. And then if it resonates to you, just repeating silently a mantra to yourself, perhaps, I am calm, I am safe, I am grounded. And you can stay here as long as feels good, as long as you have time for. When you're ready to come out of this and move into the rest of your day or the rest of your evening, just taking a brief pause to notice what it feels like in your body, to move gently, to reconnect, to give some loving care to this body of yours. Thank you so much for joining. I hope you feel wonderful after that practice. Let me know how you feel and if you have any questions.